and there's just some openings. Good. All right. Easy here.
I was in a motorcycle accident and I flew about 20 feet, T-boned a SUV, broke my nose, dislocated my shoulder. Does that hurt your hand?
No.
Are you sure?
Yeah.
I didn't think you can crack multiple areas like that. Damn, you're strong, dude. Oh! You said a soft pull. Oh my God. I think that was the best one. The reason I'm here is I have a lot of neck problems. Like right now I want to crack my neck. Like I constantly crack my neck. I was in a motorcycle accident in like 2012 and I flew about 20 feet, T-boned a SUV and broke my nose, dislocated my shoulder and didn't have insurance at that time. So they just like looked at me and said, oh, you're good, go. And I was like in and out of the ER in like 6 hours.
Who said that?
The ER, doctors? Yeah. I was in and out of that ER in 6 hours.
There's no way.
Yeah.
That's crazy. Okay, so actual lingering effects, what happened?
And it's not every day I have pain in my shoulder, but it's at least like 3 or 4 times a week, 5 or 6 times a month. Like it's really bad where I can't.
Oh, wow.
Like I'll just sleep it off or ibuprofen. I don't take pills, so it's like either Tylenol or ibuprofen. But it gets to the point where I get splitting headaches and I just sleep it off because it's so bad. But I also have this pain in my shoulder. Like every time I roll my shoulder, like it's like constantly doing some funky thing.
So how do you feel like it's been impacting you? Like what is like the final shot for you? What made you say, hey, let's go see this guy?
Just seeing your outcomes on your TikToks, man. Yeah. Like I was like, people come in from far away. I'm like, dude, this guy's doing something different than other people. Because I don't typically I've never been to a chiropractor. Cause,
that's the first time.
Yeah, because I was like, I cracked my own neck, like and stuff like. But seeing people like, in tears and like either like happy, and I was like, I want that feeling. Like I know I've cracked my neck to the points where I'm like, okay, that's. I mean, I don't know. I guess I'm not a chiropractor, but it's felt pretty good. But I just want to at least an X-ray will give me hopefully some type of idea of what's going on. Or
I think, man. That's a lot.
Baseline, maybe at least.
Yeah. Right now, there's like a lot to unpack just because you've been dealing with this since 2012, really. I mean, even before 2012, did you have any issues?
Yeah, I've been motorcycle accidents. Dirt bikes. Yeah. Go-karts.
How many like motorcycle go-kart, some sort of like contraption accident have you had?
At least a dozen or more.
So neck pain, you get headaches? Often?
Yeah. I get only when the neck pain's like super severe. I'll get headaches. Like 3 times a month, maybe. Okay. On a bad month, 5 times. Yeah, it's only when the neck pain, like typically I can crack it and it'll go away. But there's times where I can't get to that crack and then it's just shooting like pain up to my neck and it's like radiating a headache. And
this is your neck here.
Oh, that's not good.
Yeah. And then we look at a normal. And so when we look at the curve, what do you notice about your curve compared to this one?
More forward, more straight.
Yes. So when we look at this curve, it's supposed to be measured at what? You remember?
43.
43. This is a negative 2.5 that we're seeing here. And the reason why it's because you see how it starts to curve forward?
Yeah.
Right? That's not a good thing. So you wanting to crack that neck all the time is because that curve in the neck is not there. And the thing is, your body needs that curve. So all the muscles have been built to hold a curve this way.
Is there a way to bring it back?
Yes, there is. So the way to bring that back, really 3 things. 1 is stretches and exercises, 2 adjustments, but 3 and most important, different traction blocks. So the adjustments allow more motion to go in through here. You also supplement that with the traction block so that the curve will then start to move backwards this way. The relationship of your shoulders and your neck go hand in hand. They're like brother and sister. So this here, when you have a good curve, you're good, right? The thing is, when this starts to move forward, for every action, there's an equal and opposite reaction in your spine. So if the neck moves forward, what do you think happens to the mid-back? Pulls back, right? So your shoulders are attached to where? Neck and mid-back. So if the head, if I have good posture this way, if the head goes like this, I just want you to watch my shoulders, and the mid-back goes back, what happens to the shoulders?
Sinks in.
It sinks in. It pronates this way. So not only does it move forward, but it moves forward and turns inwards. So now you're like this. And then you're stuck in this pattern, you're in this position, you don't even realize it. And then you start to lift stuff, right? There's gonna be more ways, and then you start to put more pressure on certain areas of that shoulder that are gonna hurt. Exactly. Or they're taking too much pressure instead of it being equally distributed. Oh, and then let's throw in the fact that you got thrown from a motorcycle and you landed on that shoulder, and then there's some sort of trauma. Then maybe some of the other things as well too. And so when that happens, now you have all these different factors kind of working against you, and you have scar tissue working against you. So the way to get healthier shoulders, the way to make sure that the pain back in through here and back in through here, the way that it stops is by getting this to pull backwards even more and pull this way and have that neck to actually go over your shoulders instead of being to come to that. So this is your lower back here. So this is what's supposed to look like on the right side. Do you see that curve?
Yeah.
Do you see a curve in yours?
Not much.
No. So there's a curve that starts, so this is sacrum, L5, 4. At L3 and L2, L2 starts to curve forward. Do you see that?
Yeah.
So this is starting to have this thoracic curvature start.
Too early.
Yeah, too early. So we don't want that to happen. We need more of this curve to return backwards this way. So what we need to do is get that curve. And that's why you're like this, is because there's so much pressure in through here that we need to expand it open even more. Slowly turn your head to the right for me. Oh, that's a little awkward, huh? So I want you to notice this. When you look to the right, you don't just like turn like this. You turn and like you dip down to try and compensate. Yeah, look straight again. Now look to the right. Yeah, so right at the end, for you to try and get a little bit more, you start to dip in this way. Look to the left. Yeah, and so this one's worse, yeah? Let's have you look all the way up for me. Is there any tension, pain when you do that?
No pain, but
Okay.
I can feel like
The tension
pressure there. Yeah.
Let's have you look down. Any?
Nothing.
Nothing? Okay. Stand up now for me too. And try and touch your toes now for me.
Oh, that's easy.
All right, good. No issues there? No pain? Okay. Come back up. And then let's have you go face down right here. And from here, let's have you keep the left leg straight. Lift it up as high as you can go. Any issues, tightness, pain there?
Yeah, I feel like right here
Right
about to
there?
get a cramp.
Okay. And do the right side. Is that easier or harder for you?
Easier.
Okay. In your lower back, there is also a lot of these good nerves that help your body relax as well. And so when you can't relax, or your body is just in this fight or flight state, then we know that it could be coming from in this area here too. When's the last time you felt normal?
I mean, I've always had like some pain, so I guess normal is like been a long, long time.
Yeah. So I want to loosen this area up, loosen that hip more.
Oh.
Yeah. You all right?
Yeah.
Good. Right leg back up one more time. Nice. Does that feel any easier?
Yeah.
Yeah?
Actually, it does. It doesn't, not gonna cramp.
So I want you to do is sit up here for me. So what I'm gonna do here, I'm taking a block. Now the one thing that I'm feeling is that this part right here is just really stiff
Okay.
and tight. So I'm gonna open this up here. Head down. That's good. And relax the shoulders there for me. Good. Let your body relax over the hand. Let your head go back. Easier, easier. Yep. Oh. Wow.
Does that hurt your hand?
No.
Are you sure?
Yeah, I'm positive.
Man, that felt like a lot of pressure on your hand.
Yeah.
Oh,
How does that feel?
felt great though. Damn, I always see that and it's like, you can't explain it.
No. Especially when it just explodes like that in your mid-back.
And I try to relax as much as so it's like weird to have someone else crack you.
But it's better that
Yeah,
way.
yeah.
It feels better.
Yeah, totally.
Next one, I'm gonna go a little bit lower on you. Man, some of these bones are so stiff. Bend from here, right there, yep. Bend from here again, let's open up the facets, good. Let's come back down this way. Relax the shoulders down first. Good, now let it go, yep. Oh, yeah. All right.
Take your breath away.
Yeah.
Damn, I didn't think you can crack multiple areas like that.
Mm-hmm.
Like, cause that was only within like, it seemed like 6 inches of each other.
Yeah, so I mean, each vertebrae, right, has joints to it. but it's specific joints that need that motion to be restored. So not every, like, there are areas of motion that can't, like, that already have good motion in your spine, but there's some that just don't. The ones that we just didn't have good motion at all, and that's why I adjusted those areas.
Interesting. Learning a lot.
Yeah. So one thing I'm noticing here, the rib structure over here is pretty flat. Like, this feels okay. When I go over here, there's a lot more inflammation.
Yeah,
this
my
way.
right side is like where I carry most of my pain.
Yeah, and it feels a lot where
So
it's just like this.
I'm telling you, when I do that, like
Yeah. So it makes sense because this left side was also higher. So this was higher, this was lower, like this. So this is going to also hurt as well. I'm going to push right in through here now. All right. Relax the elbow a little bit more. That's good. Just relax. Good. Okay. There you go. Now lay all the way back again. There you go. You can let the head go down. Good. So let's relax the chest. Take a deep breath in. Easier here. Let it out more. And yeah. Right there.
damn, you're strong, dude. 'Cause I felt like I was like trying not to anticipate when you were gonna do that, and it's just like, oh man, that one felt really good though.
Yeah, especially on that shoulder that you've been talking about.
But I felt that in the front and the back.
Yeah. So ribs, front and back, and we also got some of that AC joint as well too. So they go like this. So especially when you've landed, or especially with you, like your hip is too far up on that left side, so it's also going to counterbalance it on that right, so it wants to push that way. Yeah.
Really good, yeah.
Good. You're going to lay on your left side and you're going to face right here. So what I'm doing here is letting this hip open more like this. So we're rolling down like this, okay? And so what I'm doing is I'm finding that joint where it opens, which is right here. And all I'm doing is I'm pushing in like that. Yeah.
Fall on the table. I was like, he's gonna pull me too far forward, I'm gonna eat it.
It wouldn't be the first fall you ever took, right?
Oh, that was good.
So what we did is adjust this pelvis. The pelvis is also connected to this lumbar area, right? Lumbar is connected to that upper area we adjusted. But when this gets adjusted and we push on this as well too, they can take both of it with it. On this side now too. Now, this one is a little different because not only this pelvis is dropped this way, but you have a few lumbars, like you feel this right here?
Yeah.
A little different. So now we got it. And we're gonna roll again. So you're gonna roll with me this one? Easy, yep.
That was deep.
Mm-hmm.
Oh, I felt that like in my pelvis.
Yeah.
Oh, that was a deep one.
How are you feeling?
I feel great.
Yeah. Let's have you turn and face that way. All right, so in through here, you can feel this little thing here, and then up into this part right there is where I feel it. I'm gonna see how the joint moves. See, yep. So I can feel it. As soon as I'm like right here, it just doesn't move as well. And then this top one, yeah, that feels kind of rough. I feel that way. Yeah. So that's kind of the way that we want to get to and open like this.
That's what I always do.
Yeah, but we're gonna make it better. I want you to let your head relax as much as possible. Doing good in here. Let the head drop. Good. Loosen the head more. I know. You're like, what do you mean? Here. Oh!
That's what I can't do myself. See, that got like way deeper than I could ever do.
Yeah. I mean, that's exactly where we were going for.
Oh yeah.
It's like you almost had this.
That's a complete different crack too. Then I like tried to do it myself. I felt that in my ear. Like, that was weird.
So C2, which is like one of the first 3 bones here, but this part was just kind of shifted in a weird way, so we had to push inwards. And so now when I go like this, right, see how much looser that is up in top. So your head was like shifted to the right side, and now we brought it over. Now we got to take care of this side as well. How we doing?
Good.
Good. It's a different technique because I need to shoot through a little bit deeper. You learn from each crack. That's really what happens, especially with people that have their own way of cracking their neck, and there's just some openings. Good. All right. Easy here. Oh. Oh, wow.
Oh. That was intense. That was on both sides.
So we call it entire segment left, meaning like your whole spine was like shifted to this left. So basically, if I point you to this direction, do you see how like this is midline?
Yes.
And you can see this part here and how it's shifted off to that midline. So at C5, we wanted to push that over to move it a little bit easier.
But the first crack you did, I felt
first
only
crack,
on this side.
Yes.
And then that one I felt on both sides.
Exactly. I adjusted from a different contact point. We call it contact point because I'm touching a specific point in your neck and I'm adjusting through that point. The other side, I was adjusting through a different point in your neck and I went through the opposite side.
Oh wow, that's way above my pay grade.
All right, now let's do one more. Lay on your back. I want to do a little cleanup here. So let's see something. I'm not looking for anything huge. Tuck your chin down for me. Good. Yeah, that's fine. All right, put your hands on your stomach. Deep breath in through your nose, out through your nose. Keep your lips and teeth together. In through your nose, out through your nose. Loosen this chin a little bit. Let that go.
Oh my God. You said a softball. Oh my God. That hurt, but like a good hurt.
Mm-hmm.
Like way worth the hurt.
To be honest with you, I really didn't pull that hard. Your spine just kind of took it with it.
Oh man. I think that was the best one. Oh, I gotta sit up. I feel lighter. Oh, that was cool.
Let's recheck it. Turn your head again to the right side here. Way better, yeah? Left. Yeah, and you got full range now. This way. How's that feel?
It just feels lighter on my neck, like much lighter on my neck. I still feel something right here, but that could have been from that crack.
And I think right, your body's been like this for so long, and we went like this. So
Like,
we created some sort of like...
I feel it in my back too, but it feels like looser.
Yeah,
Loose.
so like we ripped through bad tissue is what we did, right? There's scar tissue that develops all these years, especially after traumas, man. And as you start to expand them and rip through them, like it feels that way. And that's why the soreness is happening. It's just because it's like working out or you had a long day. Your muscles are just ripping and tearing, but then they're repairing again in a better way. Let's have you look up. How does that feel this time?
Fine.
Yeah, look down. How's that feel this time?
Good.
Good. Stand up again. Let's touch the toes again. Yeah. Better on the back. How you feeling?
I feel good. I feel good.
Good, man. Sound good?
Exciting.
Good, man. Appreciate you coming in.
No, thank you.
What changes do you notice compared to like when you first walked in?
Now I feel lighter. I feel taller.
Okay. Yeah, that's good.
I feel way looser.
Mm-hmm. So it's like you didn't even have like that conceptual point. Like
just maybe because my neck pain was so bad, I was like, oh, I don't have back pain.
Yeah. But you're like, oh no, it's definitely different now.
But
yeah.
I feel my back feels way looser.
Good.
Way looser.